Tuberculosis, or TB, is a significant global health challenge that requires our understanding to effectively combat. TB affects approximately 10 million people annually worldwide, resulting in 1.5 million deaths. The epidemiology of TB varies significantly across regions, with higher prevalence in low and middle income countries, particularly in Southeast Asia, Africa, and Western Pacific regions. TB is transmitted through airborne droplets when infected individuals cough or sneeze. These droplets containing the bacteria can remain suspended in the air for hours. Several key risk factors significantly increase the likelihood of TB infection and disease progression. HIV co-infection is particularly concerning, increasing TB risk by 20 to 30 times. Malnutrition weakens the immune system's ability to fight TB infection. Diabetes triples the risk of developing active TB disease. Smoking damages the lungs and doubles the risk of TB infection. Overcrowded living conditions facilitate rapid transmission of TB bacteria. TB primarily affects the lungs in what is known as pulmonary TB, but it can also spread to other organs in what we call extrapulmonary TB. The global TB burden is monitored through various methods, including case notification rates, prevalence surveys, and mortality statistics. One significant challenge to TB control efforts is multidrug-resistant TB, or MDR-TB, which doesn't respond to standard antibiotic treatments. Tuberculosis prevention and control requires a comprehensive approach targeting various aspects of the disease, from medical interventions to social determinants of health. Let's examine the key components of TB prevention and control, including early detection, effective treatment, vaccination, contact tracing, infection control measures, preventive therapy, addressing social determinants, and global strategies. Early detection and treatment form the cornerstone of TB control. Rapid diagnosis and effective treatment both cure the patient and prevent further transmission. Rapid molecular tests like GeneXpert have revolutionized TB diagnosis, providing results within hours rather than weeks. These tests can also detect drug resistance, enabling appropriate treatment from the start. Early treatment drastically reduces mortality, quickly renders patients non-infectious, typically within 2 weeks, and prevents the development of drug-resistant TB strains. TB treatment involves multiple antibiotics taken for several months. The approach differs significantly between drug-susceptible and drug-resistant TB cases. For drug-susceptible TB, treatment typically involves a 6-month regimen of 4 first-line drugs: isoniazid, rifampicin, pyrazinamide, and ethambutol. In contrast, multidrug-resistant TB requires a longer treatment period, ranging from 9 to 24 months, using second-line drugs that often have more side effects and higher costs. Treatment adherence is critical for successful outcomes and to prevent the development of further drug resistance. Prevention is critical in TB control. Several measures help prevent TB infection and disease progression. BCG vaccination is recommended for children in high-burden countries. While its effectiveness varies considerably, it's most effective at preventing severe forms of TB in children, especially TB meningitis. Contact tracing identifies and screens individuals who have been exposed to infectious TB patients. This enables early detection and treatment, focusing first on household contacts who are at highest risk. Infection control measures in healthcare settings and preventive therapy for high-risk individuals are crucial components of TB control. In healthcare settings, proper infection control measures include adequate ventilation systems, UV germicidal irradiation, respiratory protection such as N95 respirators, and isolation rooms for confirmed or suspected cases. TB preventive therapy is recommended for high-risk groups who have been infected with TB bacteria but haven't developed active disease. These include people living with HIV, child contacts of TB patients, healthcare workers, and people with immunosuppressive conditions. TPT regimens include the traditional 6 to 9 month isoniazid course or newer, shorter regimens that can be completed in 3 to 4 months. Addressing social determinants of health and implementing the WHO's End-TB strategy are vital for long-term TB control. TB is deeply influenced by social determinants of health. Addressing factors like inadequate housing, poor nutrition, limited access to health care, and poverty is essential for sustainable TB control. The WHO's End TB strategy aims to reduce TB incidence by 90% and deaths by 95% by 2035. The strategy is built on three pillars: integrated patient centered care, bold policies and supportive systems, and intensified research and innovation. Effective TB prevention and control requires a comprehensive, sustained approach that addresses both medical and social aspects of the disease.